It's an honor for me to speak with you guys. Most of the time when I'm giving a talk about concussion or anything else, I'm talking to athletic trainers or other physicians. What I think is really more important, especially when it comes to concussion, is talking to you guys, the athletes, and especially for you all who are going to be leaders on your teams going into the future. The more education that you guys have on concussion, the more that trickles down to your teammates, your fellow players, and it's really critical that the athlete is an active part in us identifying and managing concussion more probably than some other typical musculoskeletal injuries like your ACL tears and things like that, okay? So your help is critical in this, in us understanding and getting a hold of the concussion issue in sports, and lacrosse is no exception, so thank you. All right, so I just want to give you a brief little talk about what concussion is, why we should care about it, some things specific to the game of lacrosse when it comes to concussion, and then a little bit about some ways in which we identify and manage concussion and some new kind of possibilities in terms of evaluating and managing it that are coming along the pipe. And thank you to BrainScope for bringing me here. Thank you to Andy. So just to start off, does anybody here know anybody who's had a concussion? Show of hands. All right, so that's pretty much everybody, and that's kind of what I would expect, right? I wouldn't ask you if you yourself have had one. I don't need to know that. That's personal information. But certainly concussion is something that I think we all have some limited understanding about if you're in the athletic community. So among high school athletes, concussion accounts for about 9 or 10% of all injuries. That's what we think. It's probably more than that because we don't have great ways of telling whether you have a concussion, unless it's obvious and you bring that to our attention. We don't have ways of checking like we do for an ACL tear. We don't have a test like the Lockman where we can tell, oh, ACL's torn. We don't have that 100% test for concussion. We're working on it, but we don't have it. So we probably missed some. Again, that's why it's critical for you guys to be involved with this. Now, among athletes, probably 20% of high school athletes will sustain a concussion by the end of high school. And maybe about half of that will have more than one. And again, that's across all high school sports, even non-contact, non-collision sports. That includes tennis, golf, track and field, football, soccer, basketball, lacrosse. All those athletes together, about 20% will sustain a concussion, and about 10% more than one by the end of high school. You still, if you're in a position like you guys are, have quite a few years left of play and exposure beyond that, right? So it's important to know that there are already a lot of kids going into college, into the professional ranks that have a history of head and brain injury. Among lacrosse players, it's probably close to about 30% of all lacrosse players, men's and women's, that by the end of high school will have had a concussion. And again, about half of that will have had more than one. So that's a pretty big number. So that's about 30% of you in the room that, statistically speaking, have already had a concussion, and 1 in 10 of you maybe that have had more. It's a pretty big number. Okay, so it's definitely an issue in high school sports and in lacrosse. Okay, but there are some differences in lacrosse that make it a little bit different than some other sports. So we don't have, in most high schools, women's football, we just men's football, and everything kind of gets compared to football when it comes to risk of head injury. But those numbers, 30% among lacrosse players, that's pretty comparable to football. So in order of prevalence, the risk of concussion, it's kind of football at the top, ice hockey, rugby, lacrosse, right down below there, right above soccer. Now, most of the risk for concussion in lacrosse comes with the men's game. And that, I think, has to do with the differences between men's and women's in terms of rules, in terms of the risk. But that doesn't say that there's no risk in the women's game for sustaining concussion. It's just slightly less than in men's. That's a little bit different than sports like soccer and basketball, where the games are pretty much the same comparing men's to women's. So in the sport of lacrosse, of course, body-to-body contact in the men's game, that's the source of most concussions in the men's side. You're looking at body-to-body contact, that's how most of the injuries happen. In the women's game, There's not really body-to-body contact, or at least there's not supposed to be. It doesn't happen quite as much. So it's mostly stick to head, ball to head, or player falls head to ground. That happens in the men's game too, of course. So it's a kind of a good opportunity to take a look at what happens to the brain when something like that happens. I brought my brain here. So this is not a real adult skull, but a model of one. And this is, of course, not a real brain, but a good model of one. This is about as squishy as a brain is. This is about the amount of space that's in there. That would be filled with fluid, but it's not connected to the skull. It floats around in there. And that means that if the head gets rattled, the brain shakes around. And it doesn't just flop out, of course. It rattles around inside this box. And this thing's pretty darn hard, right? Skull's pretty hard. This thing is pretty squishy, right? So whether it's a stick to the head, a ball to the head, player contact, helmet to helmet, shoulder to helmet, helmet to ground, or maybe no contact to the head directly, just a rapid shake or twist. That brain can rattle around in there, and that's what causes concussion. So in sports where you have a helmet, like men's lacrosse, like football, you can expect that helmet to protect you from some of that stuff, right? If a ball hits the helmet as opposed to an unprotected head, that might dissipate a little bit of that force, right? That might protect you at least a little bit from some of that injury, mainly skull fracture. We have fewer skull fractures in sports with helmets, right? Back in the olden days of football, leather helmets, no helmets at all, bad injuries like that happened. Not so many skull fractures now in the NFL or in high school football or in college football. But that's not concussion, right? So if you have a helmet on this head, it might protect you from a stick, from a ball, maybe. But is it going to help you if you run into somebody and your head shakes around like this? Does the helmet protect you from that? Does the helmet protect you if the head goes like that? The answer is no. So helmets are not perfect for preventing concussion, haven't really been shown to protect people from concussion across most sports. Maybe to some degree from certain injury mechanisms, but not overall. So the helmet doesn't protect you. I'm going to pass this around just so you guys can kind of get a sense of what it's like, what a brain feels like, what a skull feels like. Just pass that around. Try to keep it together. All right. So we talked about the mechanism of how a concussion might happen. What does a concussion feel like? Does anybody know some symptoms of concussion? What your teammate might have experienced or told you, or how you might identify it in somebody else?
Dizziness.
Dizziness? Sure, just shout out some. Anybody?
Sensitivity to light.
Good,
Loss
good.
of focus.
Loss of focus, good. Any others? Headache? Disorientation? Now, how many of those are easily identifiable by somebody other than the athlete themselves? Can you look at somebody and tell that they have a headache? Not really. Can you tell that they're having some difficulty concentrating? Maybe not. Can you tell if they're dizzy? Maybe not. You can tell if they're clearly out of it, if they're stumbling around and holding their head like this, or if they've lost consciousness. But there's a lot that an athlete can be experiencing before it gets to that point that's certainly not normal. And that again comes back to why it's important that you all know, as clearly some of you do, what those symptoms are. So there's a wide variety of symptoms of concussion. And not all concussions are the same. Most people experience headache, but not everybody. Dizziness is pretty common. Loss of focus and concentration, memory issues, all that stuff is pretty common. But even for one person that's had multiple concussions, they usually tell you that they're not all the same. And it's certainly not the same individual to individual. So one person's concussion symptoms may not be the same as somebody else's. And that makes it difficult on everybody's part to identify it and to figure out what the right thing to do is. Okay? So what are the ways in which we diagnose concussion? So like I said, we don't have these little physical exam tests that are perfect like we do for ACL tears. Do you think a concussion shows up on imaging tests like a CAT scan or an MRI or X-rays? Anybody know? No, it doesn't. Right. So even if you go to the ER and you say you've got a head injury and they CAT scan you, that CAT scan, the overwhelming majority of the time, is going to be normal. Does that mean you don't have a concussion? No, obviously doesn't. It doesn't. So we use clinical tools for the most part. Most of what we do to diagnose a concussion is we ask you questions. We do a little bit of exam, try to test for certain things like loss of balance. We try to figure out if you remember things that we expect somebody your age, your intellectual ability to remember. So like what happened in the game most recently. Ask you to repeat some words, repeat some numbers, do some simple cognitive tests. But that might be different person to person. If I ask you to repeat a string of digits, 6 digits long, in reverse order, some of you might be able to get it on a good day, others not. Some of you might have trouble with 3 or 4 on a good day, others not. So some of these tests that we use all the time, the most commonly used tests that we have for identifying concussion, really are not perfect. And so that makes it difficult, I think, for everybody. When you know that you don't have perfect tests to identify something, that makes it really challenging. And so what does that mean for me as a medical provider, for your athletic trainer, for your coach, for you? It means that there are going to be times where we're not sure on the medical side of things. We're not sure if you have a concussion. So what's the right thing to do at that point? Is the right thing to do saying, I'm not sure if he or she has a concussion. I want to be safe. I'm going to sit him out. That's probably a reasonable way to go. And that's the way that we do it a lot of the time. But what if they don't have a concussion? Well, then you've sat somebody out maybe for no reason. Now you've protected their brain in the event that they do have a concussion, but maybe you've also lost them playing time. Maybe you lose an opportunity for that athlete to trust you. Because next time they're going to say, well, I might not tell them. They sat me out for no reason last time. I may not tell them next time because I want to play. It's important to me. It's important to my team, important to my coach, important to my family. So that makes it a struggle. Now the other way of going in that situation would be, you might have a concussion, but I don't have any strong evidence to say that they do, for sure. Maybe I'll let them play because it's a big game, big tournament. It's important to them. They tell me, I want to play. I'm good. I want to play. Well, what happens if we're wrong? Then potentially we're sending you out there with an injured brain. That's probably a pretty serious thing. You only get one brain in your life. It's a little bit different than your knee or your ankle or your shoulder or your wrist or your hand. You know, some of those, yeah, you might have 2 of them. You probably use both of them. But if you have a bad problem with your knee, you know, you might end up with some arthritis down the road, but you can still function with in a pretty normal way throughout your life. You only got the one brain, and you're going to need it beyond your playing career. So if we're putting your brain at risk, that's kind of a bad deal. And I'm sure you're aware of the issues that have gotten a lot of media attention, especially in the football arena, with regard to undiagnosed head injuries, improperly treated head injuries, multiple concussions over time, and what that might mean for somebody as an adult. So that can be a potentially pretty serious problem. So when we're in a situation where we don't have great ways of diagnosing something or defining something, and the ways that we've been doing it for years and years and years are clearly imperfect, then I think, and those of us that see concussion, that are in the business of managing and identifying concussion, we need to do better. We need to educate athletes like yourselves. And we need to work in the scientific community, in the medical community, to find better ways. So we need to identify these injuries better And we need to be able to distinguish between things that are concussions and things that are not concussions. So there are some somewhat objective tools that have been in use for some amount of time, and some of you guys are probably kind of familiar with them. Most athletes at this point have some experience with the impact test, the computer test. Probably a lot of you have taken that as quote-unquote baseline testing in high school or maybe with your club teams, certainly in the college arena. That's a pretty standard part of getting your incoming athletes physical. So you'll take a computer test, an assessment when you're presumably normal, have you do a bunch of tests on the computer, test your reaction time, basic cognitive tests, visual memory, verbal memory, things like that. And then if you have an injury, you take that test again at some point and you can compare it to whatever that baseline is. How many of you guys have done a test like that? Yeah, quite a lot, quite a few of you. So it can work really well if the baseline is good. Now, if the baseline isn't good for whatever reason, say you took the baseline test, you weren't really trying that hard, it's just something that somebody told you you had to do. Maybe it was kind of a bad day, maybe you didn't sleep that well the night before, maybe you're just having trouble, your mind is on something else. Maybe that baseline is kind of off. Maybe that baseline, you don't perform all that well on that test. Then you take the test again, might try hard, you have an injury, you want to go back and play, you're going to try as hard as you can, but your brain's not quite recovered yet. Well, if that baseline is kind of bad, and your test during the injury is kind of bad, those might look the same. And then we're saying, looks like you're good. Let's get you back out there. Well, if we don't know any better, because the athlete hasn't told us, hey, I'm not quite right yet, they're saying, I'm ready to play. Well, then we have no real good way of knowing that that's the case, right? So you can game the baseline on some of those tests, right? There are some others where you can game the baseline, do poorly on it for whatever reason, purposefully or not purposefully, and then we have a difficult time figuring out whether you're actually at your baseline. So that's a challenge with some of those objective tests. That's why they're not perfect. There's no perfect test yet. Now, the company that brought me here today, BrainScope, from down the road in Bethesda, has a kind of interesting product. You really can't game it. What it is an EEG that's been processed through some artificial intelligence algorithms that looks at the brain waves and how they react to head injury. So compared over time, athletes with no head injury, civilians, non-athletes with no head injury, what certain kinds of their brain waves look like, and then people with head injuries like concussion, and even people with more severe head injuries like bruises in the brain, bleeding in the brain, the things that might show up on an MRI or a CAT scan that we really want to know about, right? So those things are different. Now that doesn't matter whether you're trying or not. We put a little hairnet on you that tests those brain waves, run it through a little computer. We can do this on the sideline or in the training room. And it'll tell us whether those brain waves are off compared to what we think of as normal. So that's something that is kind of interesting. We're starting to come around to something that's truly objective in terms of head injury identification and management. But it's not widely available or in use quite yet. Probably going to get there at some day. We're moving forward in the right direction. Now, the other things that are interesting about this now is now we can baseline for individuals. So we know that not everybody is the same, right? Not everybody's brain works exactly the same. And so if this piece of equipment spits out a number, say it gives me a 65% on this number, the BFI. This is the term that we use to identify these mild brain injuries like concussion. Is that the same? Is that normal for you? If it was 80% and then it's 60% when I test you one time and then another, is that normal? Is that okay? Are we okay with that? Well, we weren't sure before, but now we can do a baseline on an individual person with this test and say, okay, for this person, they're still within normal, or no, they're not normal. Even though it would have been a normal number in isolation for somebody else, for them it's not normal. Now we can identify it. And then we can do it again. And the other interesting thing about this is what we've found, studies that BrainScope has done, is that if you take those athletes that have had a concussion, we've identified them as having a concussion with our standard tools, and they've had the BrainScope test that says, yeah, looks like their brain function index, this number that it spits out after all the computation that it does, that looks like it's abnormal, everything fits. Then we ask them, okay, come back to us when you feel normal. And all the other tests look normal. We say, okay, according to our current guidelines, looks like you're good to go. Looks like you're good to start getting back into play. Well, we check their brainwave test again. There's about 20% of those athletes that still are not normal on that test. They feel normal, at least as far as they say. They test out normal in other ways, but there's something different about their brainwaves, not quite back to their baseline. Now that's a little bit interesting. That's a little concerning. Does that mean that that 20% of people is not completely recovered? That there's something different about them that their brain has not recovered yet? What happens if we put them back out there and they get another hit, or they're just exposed to the athletic environment or the classroom environment? I don't know. That's an interesting area of further research that's being studied right now. But it just goes back to the point that you guys are really the most critical piece of concussion identification and management. I rely heavily on the athlete to tell me, I feel 100%, and I need to be able to trust that. There's no other way for us at this point, for most of our institutions, most of the places that we're going to be seeing athletes, most of the training rooms and clinics, there's no other great way for us to know for sure whether you're good aside from you telling us and we're doing some tests. So we do some of that stuff. We're moving along in the right direction, but you are a critical piece to telling us whether you feel okay or not. All right, so I obviously hope that none of you guys are in that situation ever, but statistically speaking, most of you are going to experience something like this, or you're going to see it in a teammate. And that's the time to bring it to the attention of your athletic trainer, your coach, your team captain, your team physician. Critical, critical. Otherwise, we're going to miss stuff. And then that's putting you guys at risk. All right? Anybody have any questions? Got the brain. All right. You got the top of the skull? All right, perfect. Awesome. Thank you. All right, guys. Well, I appreciate your time. Congratulations again. Have a great weekend. Enjoy Baltimore.